Have you been struggling with breastfeeding? You've tried every position and it still hurts? Your baby might be trying to tell you something. So stick around because today we're going to talk about a relatively common issue that could be the culprit. By the end of this video, you're going to understand what a tongue tie is, how to assess it properly, what to do about it, because you have multiple options. There's not just one option. And a commonly missed item that when treated along with the tongue tie makes a world of a difference for nursing mothers. Tongue tie is the second most common cause of nipple pain in nursing mothers, and it's estimated that 2 to 10% of babies are going to be diagnosed with the tongue tie, most commonly in females, which is interesting. It is a congenital condition, which means that it can run in families. So if you or your partner had a tongue tie as a baby, it's more common that your baby will also have a tongue tie. What is a tongue tie? Underneath our tongues, we have this mucous membrane that's called the lingual frenulum, and it connects the tongue with the floor of the mouth. This can look all sorts of different ways. It can be long, it can be short, it can be thick, it can be thin. It varies in appearance. But when it is short, fibrous, like really tough, thick, this is commonly referred to as a tongue tie. It affects the mobility, the movement of the tongue. It affects their eating, their speech, and sometimes even their breathing. How do you know if your baby has a tongue tie? Well, here are very common symptoms that mummies will notice. 1, painful breastfeeding. It just hurts. 2, your nipple is pinched when the baby finishes latching or finishes eating, and it kind of looks like lipstick. Like the tip of it is just pinched. 3, you might notice some clicking sounds when they're nursing because they're losing suction, because their tongue is not able to cup the nipple. So it's like trying, it's pulling, and then it's compressing it, and then it loses it. And you might hear like a sound coming out of the corner of their mouth, or an actual like clicking sound. Milk leakage, milk dripping out of the corner of their mouth, because they can't keep it in. When they cry, their tongue is staying down or at least lower. There's not raising all the way up. And sometimes you notice it when they're eating, their jaw kind of jerking. They're using their jaw to nurse, moving back and forth. Now, this is commonly what mummies notice when they say, I think my baby might have a tongue tie. And then they take them to the doctor. And the doctor needs to assess them properly. And there are a few ways to do this, but what we're primarily looking at is we want to look at the appearance of the tongue and the function of the tongue. Now, unfortunately, a lot of mummies will bring their babies in and the doctor will just look at it, and if the tongue is not making a heart shape or staying down when the baby's crying, then they'll say no tongue tie. Or if it is even slightly, oh, tongue tie. Tongue tie there's a lot of controversy about this topic right now because it might be getting overdiagnosed because we're not assessing these babies properly. Now, one of the most reliable methods is through an ultrasound or through the Hazel-Baker assessment tool, which I will show you. When a doctor uses the ultrasound, they have the mummy nurse the baby, and then they put the ultrasound right along the baby's jaw to watch what is happening when the baby is drinking this milk. A lot of mummies, they don't get that kind of assessment, right? They just get a visual assessment. It's not enough. This is not an accurate assessment of a tongue tie. When the baby is being assessed, we need to be looking at the function of the tongue and the appearance of the tongue. Now, sometimes an ultrasound is used, which is great because you're really looking at the active nursing of this baby. You have mummy and baby nurse, and the doctor will put the ultrasound to watch what is happening inside the mouth. How is the tongue moving? Is it creating a negative pressure vacuum? Where is the nipple being placed within the hard, soft palate of the mouth? But unfortunately, a lot of the times, we're just going off of appearance. You know, they'll look at the baby's tongue and be like, oh, it's down, yep, tongue tie. Or, oh, nope, I don't see a heart shape, not tongue tie. This is not accurate or thorough enough of an assessment. The frenulum is only one factor of what impacts the tongue mobility and the tongue function. There are 4 different classes of tongue tie based on the severity of the tongue tie, which you'll see here. But there are also 2 different types. There's the anterior and there's the posterior. Anterior means it's in the front. That one's really easy to see. Posterior is not easy to see. That's where we see the function of the tongue impaired, and it's not moving the way that the tongue is supposed to have the freedom to move. This is why it's really important to assess the appearance and the function at the same time, not just one of them, because posterior tongue ties, they also need to be felt. Now, before we get to how to treat it and what to do about a tongue tie, if this video has been helpful in any way, if you have learned anything, will you just give it a like and subscribe so that more videos can keep coming to help mummies like you? How is a tongue tie treated? Now, there are a number of ways to treat a tongue tie, but one of the most common ways lately has been a frenotomy or a frenectomy, which is where that lingual frenulum, the mucosal membrane, is snipped with scissors or it's cut with a laser. There is a controversy about this method because it is also estimated that the tongue ties are being overdiagnosed and this procedure makes money. So is it really needed, and is it effective, and what about the side effects? So there's a lot of conversation happening right now over this use of procedure for a tongue tie and if it should be the first course of action. And if mothers are even given any other option, because a lot of times they're just told, you just do this, painless, no side effects, baby heals quickly. Sometimes that's not the case. Hopefully it is, but sometimes that's not the case. And sometimes this procedure has no improvement in breastfeeding because babies who have a tongue tie often also have other midline defects such as cleft palates and apnea and different things. So the issue is not resolved with this solution. Some moms that I've worked with, this has solved the problem for them. Like they had their baby's tongue clipped and they didn't have any pain. Other moms had it clipped, had a terrible healing process, their baby's in pain, no improvement in breastfeeding. So it definitely isn't a one-size-fits-all solution. And mothers should be given more options and more choices for how to treat this in their baby. And not be told, like, if you do this, 100% your breastfeeding problems are solved. Because that is not the case for every mother. Another way is, we think about our muscles, right? Think about your muscles and your joints. And what is connecting them? Tissue, fibrous tissue. And what do we do when we want a greater range of motion? We stretch it. This mucous membrane is also soft tissue, which means it can be stretched. Sometimes it can stretch to a certain point, right? Just like the rest of our body. But sometimes that slight improvement in mobility makes all the difference. So how do you stretch this? How do you exercise the mobility of your baby's tongue? There are a couple different ways. There is the physical stretching of it, which means you take your thumb and you can rub upwards in an upwards motion underneath their tongue in a way that stretches it up. You can also move your finger along their gum, always washing our fingers, right? Move your finger along their gum line to see if their tongue will follow and push against it. You press down in the middle of their tongue and then lift up. And this is training them to like almost form a little cup. And then you can also use your finger or a soother for suck training, where you place your fingernail down on their tongue and the pad to the roof of the mouth. Put your finger in their mouth, let them suck, form it, and then slowly start to pull out. This is causing them to start to use their tongue to maintain suction on your finger rather than their jaw clamping down, and also for them to learn how to position the nipple so it's not at the front of the mouth, it's pulled farther back towards the hard, soft palate. And that's when you get a more comfortable latch. There are also breastfeeding options for different positions and how to place your baby who is struggling with a tongue tie in a way that is more comfortable for you both. And the biggest point of this is to get their chin as close to the breast as possible. So prone position can help mummies a lot because the chin is down and it's pressing against the breast tissue. When a baby has a tongue tie, they're just gripping the tip oftentimes. And that's what's causing the compression and the pinching of the nipple and just a painful feeding. Breastfeeding positions that push their chin against the breast, it allows them to have a wider gape, which lets the nipple go farther back in their mouth. And then if we compress the breast at the same time and then support their jaw with our other hand, it's kind of like that. That can give you some relief when you're breastfeeding. You have multiple options. It's not a one size fits all solution. Nothing is in taking care of a baby, right? Each baby's different, each mommy's different, your family needs are different, your preferences are different, but you have multiple options to try. Now, my baby was born with a pretty severe tongue tie and a lip tie, which we're about to get into. And I just did that stretching and that suck training with her for weeks. It took a long time. It took 6 weeks until she was able to actually have the energy, because she's premature, to withdraw milk herself, and then also to learn how to use her tongue. So we weren't able to comfortably breastfeed and effectively breastfeed until she was closer to 7 weeks old. But it worked. Now, one thing that is often missed when talking about a tongue tie is assessing the upper lip as well. Because oftentimes when you have a tongue tie, this upper lip is also tied. Same mucous membrane, it provides stability for the upper and lower lip. And so you can do that same kind of stretching with it. But if a baby's lip is tied, they can't open it. They can't create a wide open latch. And their lip, you might notice their lip kind of tucked in when they're nursing, or you see this kind of like crease in the corner of their mouth. This is very commonly missed. And if the lip tie is very far down on the gum, this also has a classification scale. It can also lead to a big gap in their teeth when their teeth finally come in. So stretching out that can be very helpful. Of course, there's also the option of clipping it. So if you think that your baby has a tongue tie, check the upper lip as well. I hope this video has helped. I hope it has given you some good information. You feel empowered, you feel confident, and you understand what's happening and what you can do about it. Love ya. See ya, pizza.